Studies show that only about 10% of patients with opioid addiction actually report getting treatment for it. The lack of access is definitely a contributing factor to our opioid epidemic. And no patient, no one dealing with the opioid addiction is to blame for that. One part of that solution is increasing access to medications like Suboxone using telehealth. Medication for opioid use disorder via telehealth has been studied by researchers at RAND in collaboration with some researchers actually here at Bicycle Health. And those results were published in peer-reviewed journals. The first study actually interviewed patients getting care from Bicycle Health. Here's what they found. Patients were satisfied with their treatment via telehealth. Patients found telehealth easy to use and understand. Patients were able to initiate telehealth opioid use disorder treatment quickly compared to regular in-person treatment. Patients found treatment via telehealth to be easier to access and less stigmatizing than in-person treatment programs. Patients really liked that telehealth treatment limited their risk of exposure to other who are in active addiction. And over 3/4 described their experiences with telehealth treatment in positive terms, emphasizing how patient-centered it is compared to in-person care. The second study was actually published in the BMJ, and this looked at Bicycle Health's telehealth treatment model. In that study, it was that patients stayed in recovery longer than traditional in-person care. And to elaborate, 80% of our patients paying with insurance were still in treatment after 90 days compared to the industry average of 44% after 90 days, right? It's almost twice as successful. The study also found patients were more likely to show up for their doctor's appointments at Bicycle Health. Our patient no-show rate at Bicycle is actually about 9 to 10%, compared to about 23% on average for in-person appointments. I'd also had researchers at the CDC, the Centers for Medicare and Medicaid Services, and the National Institute on Drug Abuse, aka NIDA, which is a part of the NIH. They also found that expanding telehealth for medications for opioid use disorder during the COVID pandemic actually increased the likelihood that patients received medications like Suboxone and received therapy or counseling services. They found that telehealth for OUD reduced the risk of overdoses. Let me repeat that. Telehealth for OUD reduced the risk of overdoses. It's saving lives. You know what? I want to add that all this research, these people's stories that show that Suboxone over telehealth is safe and effective, it's even convinced some government officials. In fact, medication for opioid use disorder via telemedicine or telehealth has been endorsed by multiple groups. The Bipartisan Policy Center think tank, the House Ways and Means Committee, the National Governors Association, and the Biden administration. And as of December 2022, the good news is that the Biden administration signed an omnibus bill that creates a permanent path to keep medication for opioid use disorder through telemedicine accessible. All this research shows that prescribing Suboxone using telehealth works. Telehealth is making it easier for patients to access treatment, and a lot of patients prefer it. Now, I can't say that this is causal, but I do wonder how much telehealth has contributed to the fact that opioid-related overdoses have actually declined in 2022 compared to 2021 nationwide. Unregulated and unethical prescribing of opioid pain meds has definitely contributed to the current opioid crisis. But Suboxone is different. Suboxone is safe. Without getting into the details, as a partial opioid receptor activator, it's highly unlikely that one can overdose directly from Suboxone. For the majority of people, for the majority of patients, getting a Suboxone prescription over telehealth is absolutely safe. And that being said, if you're taking other medications or using other substances that are sedating or are considered, downers, that requires a longer discussion with your healthcare provider.